And this is different than any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. Just everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintans, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes. What's happening, Performance Therapy Nation? This is Mike Quintans, your host of the On Cue Performance Therapy Podcast. I'm joined today by Dr. Tricia Beatty, partner in sports medicine physician at Beatty Harris Sports Medicine, located in Newtown Square, Pennsylvania, 20 minutes outside of the city of Philadelphia. Today, we will be covering a multitude of different topics, including the misconceptions and defining misconceptions of sports medicine and defining sports medicine, techniques Dr. Beatty is using in her clinic, and what it's like being a female in a male-driven field, and so much more. But first, I want to thank our listeners for showing the On Cue Performance Therapy Podcast some love by subscribing and leaving 5-star reviews. Shout out to Matt E. this week, who wrote, "Interesting to hear about the egos of physical therapists, chiropractor, and swing coach triumvirate when assessing a patient. Host has a radio voice, flattering, and looking forward to future episodes." So let's give Matt what he wants. So like I said, we're joined today by Dr. Beatty, who is a sports medicine physician. She attended Syracuse University and Ursinus College, followed by earning her doctorate in osteopathic medicine at PCOM, the Philadelphia College of Osteopathic Medicine. Dr. Beatty's postgraduate training consisted of an initial internship at the Naval Medical Center, Portsmouth, in Portsmouth, Virginia. So she then moved on to flight surgeon training at the Naval Aerospace Medical Institute in Pensacola, Florida. She practiced as a naval flight surgeon for 3 years in the Naval Air Station in Corpus Christi, Texas. She then returned home to complete her residency at Bryn Mawr Family Medicine, followed by her fellowship in primary care sports medicine in Springfield, PA. Other accolades include you were named 5-time top doc by Mainline Today magazine. So welcome, Dr. B. How you doing?
I'm good. Thank you so much for having me.
Yeah, so this is something you and I have talked about doing for a little bit now. And you're like, I don't know, should I really do it? Like, I want to do it. And I don't know if you listened to one or you were around for one, but you're like, I think I want to do it. Let's do it. So what made you take the leap?
I think it's important to put out one's views and talk about what we're doing at Beatty Harris Sports Medicine now that we just started our own practice. I think it's great working here in your clinic and having that continuity of care with patients. And I thought it'd be fun to share thoughts and talk about stuff.
Love it. We were just joking around a little bit ago before, like off air, about how we could probably have a conversation for an hour about anything. So you and I have known each other for some time now, and this is cool to do. So
Yeah,
I'm stoked to do it. I want to dive into your past in terms of education. So Syracuse, awesome.
Yes.
And then came back home with their Ursinus, and then Naval Academy, so forth. So fill me in. So tell me, like, kind of give me the rundown of schools, what you did, if you did sports there, majored.
So I started at Syracuse. I was a diver there, and that was a really great experience. It was nice to go to a big school and figure out what I wanted to do. And when I was sure that I wanted to pursue a career in medicine, I transferred to a smaller school where I felt I'd have a better education for what I was looking for. Ironically, they had gymnastics and not diving, which was my initial sport, but had been out of it for too long. So I didn't pursue gymnastics at Ursinus, focused mostly on my studies, was a great school. I got a great education. And then I went on to go to PCOM for my DO degree. And another phenomenal education. The approach that they used was system-based, and it just fit the way I think. And while I was a student there, accepted a scholarship from the Navy, so they paid for part of my education. And then I needed to pay back the time, so I did my first postgraduate year in the Navy at Portsmouth Naval Medical Center. And from there, I could have gone on to residency, but I decided to try being a flight surgeon for a bit of time, which was probably the most amazing experience.
I'm cutting you off right there. That's awesome. I want to know about being a flight surgeon. Like, what is that, and what does it entail?
It's a good question.
What attracted you to it?
I think the name is a bit of a misnomer, so there's no surgery, but basically you are the primary care physician for a squadron, and the training before you practice as a flight surgeon is so that you learn the pathophysiology of aerospace medicine, the rules and regulations, as far as what conditions pilots and aircrew can fly with, or what disqualifies them, and the wavering process of certain conditions and medications. And the best part was that the Navy really feels that the flight surgeon is better equipped to make decisions about readiness to fly when they are themselves flyers. So we were required to fly with our squadron a certain amount of hours per month. I forget what it was, but and it really does, give you insight into what your patients and pilots are experiencing, when they're pulling G's and, doing maneuvers that, you can't really understand until you do it. And, it helps you make more informed decisions about whether or not they should be safe to fly. And, you're just better at your job. So
what kind of information were you getting from your patient or the pilot in that case? Like how would you practice? Like, what would you do?
Well, they come to see you for anything. So, common colds, gastrointestinal illnesses, a lot of orthopedic issues, dermatology conditions. And then, mostly the age group are younger, healthier individuals, especially in the pilot cohort. So there isn't a lot of underlying chronic conditions, but there are some things that develop in men and women in their 20s and 30s that you diagnose them with. And once they're pilots, are they able to continue flying with that diagnosis, and are the medications compatible with flight? And I think another aspect that I really liked about being a flight surgeon, and it's much like being a team physician, is that they were my people. They were my squadron was my team. And, flying with them, they were like my team. So there was, maybe 200 were in my squadron, and then we were part of a bigger training air wing, and I think there's about 1,000 total. So it was a, tight-knit crew. And I took good care of them.
That's wild.
Yeah.
That's wild. Did you know anything about that while you were at PCOM, or
no?
When did you hear about being?
I guess when I was an intern. Yeah, my internship year. The options were to be a general medical officer on an aircraft carrier or a boat of some sort, undersea medical officer on a submarine. And a flight surgeon. Those were the sort of the three options other than going on to residency.
That's wild.
So.
All right, cool. So I cut you off there. So after you were a flight surgeon, what were the next steps after that? Yeah,
so I practiced there for 3 years, and then my obligation to the Navy was up. So I returned home to Philadelphia, and I started back in my medical training. So I started as a PGY2, so my second year of postgraduate training, and that was in family medicine.
Okay, and then from there, at what point did you know that sports medicine's the way you wanted to go? Because you had a taste of family medicine after your time with the
Yeah, it's funny. When I when I first went to medical school, you kind of go through all the rotations and you think, oh, maybe I want to do this and maybe I want to do that. And orthopedics was something that really interested me from the get-go. And then, I did the Navy thing and flight surgeon and sort of wasn't really sure after that what I wanted to do. I had 2 kids by that point, and family medicine seemed similar to what I was doing. And I liked what I was doing. So I decided to do a family medicine residency. And then quickly realized that family medicine in a non-military population is a lot different. And, there's layers to that decision, but I rotated with another sports medicine physician as part of my training and was immediately, this is it. This is what I want to do. So that was actually my second year of family medicine. So I had a short period of time to, compose my application to sports medicine fellowships, and I got a great one.
Yeah, you went right into fellowship.
Right into fellowship, yeah.
Is that typical?
Yeah.
Okay.
Yeah, I mean, some people will practice for a bit and decide that, they really like family medicine, but maybe they feel a little bit weak in musculoskeletal medicine, and they'll do a fellowship with the purpose of going back to practicing family medicine, but just offering, more expertise in sports medicine, especially if they work in a rural area where there's not a lot of specialists to refer to.
That makes sense.
Yeah.
So tell me about your fellowship. You were involved with teams. Teams with this, right?
So my fellowship was at Crozer. I want to say it was either the first or the second year that they were taking care of the Philadelphia Union. So that was a fantastic experience, taking care of a professional soccer team. We took care of a couple local high schools, University of Delaware. Did we do anybody else? No, I think that was it. Yeah, so all levels, high school through college and professional.
What did you take away most from your fellowship?
I guess the process of coming up with a diagnosis, really is asking a good history, doing a solid, consistent physical exam, kind of knowing what you're looking for when you're examining the patient. Mechanism of injury is huge. Understanding how it happened and knowing your anatomy gives you so much of what you need. And knowing who's treating your patients. So, when referring to physical therapists, who's getting better, what they're doing, what their philosophies are, establishing those relationships with the people you refer to, both physical therapy and then also referring on to surgeons if it's a surgical problem.
Yeah, I feel, in my opinion, that what sports medicine does, and I want to get your definition of it and dive into sports medicine in general, because I feel like I have a lot of patients that have asked me in the past, like, oh, wait, you want me to see a sports medicine doctor? Are they a surgeon? Like, what do they do? Are they an orthopod? Like, that's a classic. Are they an orthopod?
Yeah.
I'm like, no, they see sports medicine. Like, see them as like your primary care doctor will send you to a dermatologist or wherever the heck else you need to go to get treated for your condition, neurologist, oncologist, whatever. Sports medicine dictates what is best for you next to continue an active lifestyle.
Yep.
Right? So maybe
absolutely.
It's injections like PRP or whatever it may be, PT. There's a number of different options. But I guess that's how I explain it. How would you explain what sports medicine is? I
think it probably has a few definitions. I mean, the way I've chosen to practice is that, a lot of what I do is non-surgical orthopedics. And then there are also aspects of what I do that is more medicine, so concussion management, and then also managing medical conditions in an athlete, kind of going back to what it's like to manage medical conditions in a pilot. So there are certain things that, you might have a dermatologic condition and you're a wrestler. And so, I need to be able to diagnose what that is. Is it safe for you to participate? Do I need to hold you out? So having that family medicine background, I think allows me to take better care of the whole athlete while having a specialty in the actual orthopedics of injuries and that aspect, which I think is what most people think of with sports medicine.
All right, so settle this whole DO MD debate for me.
Yeah.
I don't know if there's much of a debate, but
I don't think much anymore.
Yeah,
I think long ago there was probably, some controversy and strong opinions on one versus the other. But I think the way I look at it is that, an allopathic education, like getting an MD versus an osteopathic degree at this point is, well, I should caveat that with, I didn't do an allopathic training, so I don't really know what that is like, but it is very similar. I mean, we learn all the pharmacokinetics, the physiology, the pathology, all of the medical knowledge is the same. And then there's the hands-on, osteopathic manipulative medicine that, allopathic students don't get, that osteopathic students do. And there probably is some philosophical differences and, a more holistic approach. But I think that's probably evened out in both types of training at this point.
It's interesting to me, the whole concept, and I didn't know this honestly until I was in PT school. So I took my gross anatomy course at Widener, was actually taken at PCOM.
Oh.
So I went to PCOM 3 days a week, and
that's awesome.
Dr. Kivist, I don't know if that name rings a bell, has been around forever.
Yeah.
So he taught us that course, and I was amazed by how focused the curriculum, because I'd known someone from Bloomsburg that was going there at the time, how focused the curriculum was on musculoskeletal, and
Yes.
and that you guys were doing hands-on manual therapy,
Yep.
osteopathic techniques.
Yep.
And I thought only chiropractors and maybe a handful of PTs did that. And the value in that, in my opinion, if that practitioner chooses to use those tools, is, that's you can't put a price on that. I think it's awesome.
Yeah. Yes.
Right.
Agreed.
Cool. All right. So can you explain what PCOM is? You said you had gone to PCOM.
Mm-hmm.
So it's the Philadelphia College of Osteopathic Medicine, right? Yep. Okay. So, and that's where you went there for how many years?
4. Well, medical school's 4 years, but 2 years were on campus at doing, the academic in classroom aspect of our training. And then the second 2 years, you're on rotations. And I did my first year of rotations at a variety of hospitals and clinics across Pennsylvania. And then my second year, I did nearly entirely at the Naval Medical Center in Virginia. You're able to arrange rotations wherever you would like to some extent. And so I did a lot of them there.
All right. So your background's in sports.
Yes.
And you're a Delconian like myself, and choose to practice in Delco, which I admire. So I get it. Tell me about your background in sports. And I know, as you know, this area outside of Philadelphia and Philadelphia in general, fanatics about sports. And that doesn't just include professional sports. It's all sports, in my opinion.
Yeah.
From kids to 6-7-year-olds. It's crazy. So your passion in sports and how that trickles down to your passion now treating patients in this area.
Yeah. I grew up as a gymnast. My mom put me in like everybody else when they were 3 and never took me out. So did that up until I was about 17. And in high school, I also dove and I ran track, sprinter, hurdler, long jump, high jump. And I think what I like most about, there's a lot of things I like about sports, but, it's a great way to stay healthy and active but the character development of an individual who, has a sport that they're really dedicated to is priceless. Hard work and persistence and, get up and do it again. And all of those features of being an athlete, I think, are great. And I want to allow people to be able to participate in whatever activity they feel is right for them. So, in my little guys, it's, playing, maybe unorganized sports and recess, and as that grows into something more competitive, and then sort of full cycle when you're older, and redefining what activity looks like, just, keeping people active, appropriate to their goals, is really rewarding.
Character. You dropped the term character. I couldn't agree with that more. I played football in high school and college, wrestled as well in high school. But there's nothing like, in my opinion, being on a team, whether it's an individual sport or not. When you interact with different people from different realms, or where they grew up, or what their race is, or whatever else, but there's one common goal. You can't. How else do you get that?
Yeah. No,
I have the privilege of working with you every day, and you're walking past today, and I asked her, I was having a conversation with a patient about concussions, and she had asked, well, you played football. Would you let your, son one day play, if you were to have one, play football? I was like, I really don't know. I couldn't give her a straight answer. And I asked you walking by, and you treat concussions. I have seen them, but I'm not a specialist in them like you are. Yeah. So you know more than I do about them, and some long-term effects. So I had asked you, would you ever let your son play football? And you said, yeah, I would. No, didn't even hesitate. You're like, yeah, absolutely.
Yeah, I mean, like anything, you have to balance the potential for bad with the known elements of good. And, obviously, if you have a child who has had a concussion or 2 or 3, then you start having a conversation about, is that the right sport going forward? But not everybody gets concussed. And there's just so many positive benefits, social, emotional, physical, and all of that then sort of translates into how you approach other challenges in life as you go forward, and maybe college or career choices. And
Amen.
Yeah. Well
said. So, misconception about sports medicine: you only treat athletes.
No, not at all. Not at all.
Go ahead, shoot.
Yeah.
So, what else do you treat? What do you want to see in the clinic outside of athletes? Obviously, you want to see athletes, but what else? Who else could benefit from seeing you?
I mean, pretty much everyone with a body who moves. I mean, that's who we treat. So like I said, I have, 8-year-old patients, I have 103-year-old patients, and, sports to the 8-year-old is maybe walking up the stairs to my 104-year-old. And my job is to keep the body moving and doing what it wants to do or needs to do, and in a non-surgical way when appropriate.
All right. So the other misconception is, all right, if you're not going to do surgery, then what are you going to do?
So many things.
Shoot, go ahead.
Yeah. There obviously are conditions that are surgical, but so many issues in the human form are non-surgical. So there's, referring for physical therapy and making sure they're going to the right person for that problem. There is, fracture care. There's, chronic tendinopathy. You can treat that with obviously physical therapy, injections, cortisone injections, PRP, both for joint issues and chronic tendinopathy. There are, a vast array of other injections for arthritic joints. There's hyaluronic acid injections for, there are amniotic injections, which are not covered by insurance, and but can be helpful for both soft tissue and joint problems. There is, and I think not just the variety of treatment that we offer, but I think that it really goes back to an accurate diagnosis, is I think where we have value. And then, the treatments that obviously that we offer, we're experts in providing them and actually administering injections and procedures like 10X and 10Jet. And but it all starts with an accurate diagnosis.
Amen.
Yeah.
So I describe this as your role in a patient's recovery is guiding them through the continuum of care and recovery from their injury, right?
Yeah.
So musculoskeletal injury, it could be a different injury. Maybe it's, all right, this isn't musculoskeletal, this is something else. You need to go here. So what's the next step? And maybe it's an intervention that you can provide.
Right.
That's the coolest part. Like you provide interventions like the day of your evaluation. That's also, maybe it's ordering an image, maybe it's whatever it may be, but that goes back to the diagnosis.
Right.
And then are they like, okay, PT's not working. What's our next option?
Right. So you have to, one, reevaluate the diagnosis. And two, if you're, you've done the imaging and you're sure that that's the diagnosis, then you look down the line, well, what's the next treatment? And depending on the problem, if it's an arthritic joint, maybe they're stronger, but they still have pain. So possibly a cortisone injection or hyaluronic acid injection. If they have tennis elbow and, again, they're stronger with PT, but they're still having pain, something like a tenotomy with TenJet, or 10X are fabulous procedures.
So much has changed.
Yeah.
Like over the last, and I've only been practicing for, 6-7 years now. So much has changed even in that time.
Yeah.
That like you probably see like TenJet, 10X, Synvisc, like all these, like the Orthovis. I mean, there's so many different options there. PRP, prolotherapy. Like there's all these conservative care measures and interventions that have changed so much. Like how much saline, what's the saline percentage? Like there's so much that it's changed, like saline as it pertains to like Prolo or like centrifuging the blood for PRP. So much has changed. So you have to stay up on this.
Yeah.
I think that makes it kind of exciting. PT can be the same way.
Yeah, it's great.
Awesome.
Yeah, I mean, when I was a fellow, back in the day, we did tenotomy with lidocaine to try to avoid exposure of the tendon to cortisone. And, PRP obviously was available at the same time, but it can be expensive. And those are the two options, really. PRP, maybe Prolo, lidocaine tenotomy. And then sort of the next step, it evolved into having a tool to actually do the tenotomy and not only just needle the scar tissue in the tendon, but to actually take it out. Sort of same procedure, but different mechanism that you're holding and way better outcomes.
So tell me about that, because I know there's PTs that have no idea like what exactly you're doing when you're doing these techniques, much less like the average athlete or individual or anybody else who's active with a tendon injury. So Can you dive into like, all right, what exactly are you doing with the technique? What's the goal? And what are the outcomes typically? What do you expect?
So the problem with tendinopathy is that there's scar tissue in the tendon, and the goals of physical therapy outside of solving the underlying issue that led to the problem, but the actual treatment of the tendon that's hurting is to break up the scar tissue through either eccentric strengthening and or ART or Graston, and so sometimes that's effective. And sometimes it's not. And so when it's not effective, so there are options to break it up, more invasively. And I sort of use the word invasively loosely. And like I mentioned, initially that was just taking a needle and under ultrasound, watching the needle kind of perforate the tendon. It's called a needle tenotomy. And so you don't take anything out, but you're trying to increase inflammation and give the tendon a second opportunity to heal in a more protected environment. And, but nonetheless, the scar tissue is still there. And sometimes that was effective, sometimes it wasn't. And now we have tools that take the pathological tissue out. So you identify it under ultrasound and, anesthetize the area and, insert the instrument down into the tendon that is abnormal because it looks different on ultrasound. And the tool cuts it out. So the mechanism between TenJet and 10X are a little bit different, but it cuts the tissue and takes it out.
What a tool in general, but the ultrasound machine.
Yeah.
I got to
it's fantastic.
kind of check it out. It's amazing. You can easily see the difference between scar tissue or damaged tissue, inflamed tissue, right, or normal tissue. So how super helpful, and the patient sees it themselves. It's not like only you have access to it. They're looking at the same thing you're looking at. So how often do you see these procedures they're successful? Are they and what are they doing afterwards?
I mean, in my experience, they've been really successful for all types of tendinopathy: elbows, patellar tendons, Achilles, plantar fascia. What else have I done? Hips for glute med tendinopathy. Yeah.
Awesome.
And I guess the post-operative course is a little bit varied depending on the tendon that I'm treating. Something like an Achilles, which has more tensile load on it. In certain situations, I might protect a little bit more. But I mean, you can get back to it pretty quickly. I mean, comparative to, an Achilles debridement and reconstruction, I mean, that's months of recovery versus a couple weeks.
I think you nailed it when you said sometimes like PT addresses the underlying issue.
Yeah.
But
You still have pain.
But they still have pain. Like
Yeah.
structurally, that tendon is not the same. So
Right.
if it's structurally not the same, that needs to be addressed
Right.
because they may feel good, but the second they return to activity, sport or whatever it may be,
Hurts again.
flares back up. Like there's something structurally wrong, regardless of the other underlying issues, whether it be like low back or the thoracic spine or whatever else is involved. If it's the elbow, you got to look at the shoulder and thoracic spine, etc.
Right.
But if the tendon is structurally not sound or the integrity is compromised,
It's going to hurt.
it's going to hurt. Right.
Yep.
That's such a cool tool. And that's not something a surgeon can do anything about, really. I mean, we're talking it's a tendon.
Yeah, I mean, there's debridement procedures, but it's an open procedure to some extent, depending on the part of the body that you're talking about. And the procedure they're doing is exactly what I'm doing, but I do it under ultrasound less invasively, and the recovery is much quicker.
And you're using the term invasively loosely. So I agree with you completely. It's not like they have an incision, a scalpel, please. That doesn't happen.
No, it's
So,
like 3 millimeters.
is that what it is? Yeah. Awesome. All right. So,
No stitches, just one steri strip.
and they walk out
Yeah,
right
it's
afterwards.
yeah. There's no sedation. It's done all under local. So yeah.
I'm sitting in on one of these. Can you let me know next
Yeah,
time?
sure.
I would love to sit in on one.
Absolutely.
All right. So fill me in on what it's like being a female. And again, if you don't want to dive into this, I completely understand and respect it. But I feel like you don't hold back. You call it as it is, and I respect the heck out of you for it. So be straightforward with me. You're a female. Respectfully, I hope you don't take this the wrong way, but it's like it's a male-driven field, like
Yeah.
sports, like ortho. The last place you worked at was like super, like massive. Every other person, almost every single person in that building in a white coat was a male. So tell me what it's like from like your position as a female, and now you have your own practice where everything else around is all corporate, big time names like like you have your Premiers and your Rothmans and your Mainline Health and everything else, but like it's you and your partner, Dr. Harris. Tell me, like, what's that like? And you can be as boastful and brag all you want.
I'd say on a day-to-day basis, I kind of don't notice. I mean, being a flight surgeon in the Navy was, almost completely male-dominated field as well. I mean, there are, female pilots, just like in orthopedics, there's some women coming into the field, but I think that you gravitate to the field that you feel most comfortable in. So I think I feel comfortable in a male-dominated field, probably because I'm, as you said, somewhat straightforward female, which might not be a typical, female approach. I feel most comfortable in this kind of field. I think that there are some aspects of being a female physician, not necessarily just in orthopedics, but that can make it difficult to have that, full balanced life, right? Like I have 5 kids, I'm a mom, and have to balance that. And, I really never have felt like the male dominated field so much was the issue, but just the demands of being a physician. I think what's really great about being a female sports medicine doctor is I think I've been a role model to a lot of female athletes. I have I've had a few patients that have come back and decided to pursue medicine and have asked to, shadow me. And, I've been a mentor to them to some extent. And that's been really rewarding. And that, females have decided to pursue sports medicine because they saw that I was able to do it and have a family. And so that's been nice.
So you oversee athletic teams, schools in this area, and there's one all-girl school not far from here that you oversee. So you're on the sideline, you're watching the game, someone gets hurt, it's a sad moment, but you go out there and you check on them. And they look up and they see a female, and they're like, "You're the physician. You're here to see." That's got to be like a cool moment, probably for them, but that's empowering, right?
Yeah,
That's
I think it is. That's
special.
Yeah.
I don't know if I really thought about that. I think what you do is very unique. It's special. How you carry yourself and so forth is super unique, I think. And I think your patients respect you for it because they know like you're not going to hold back. If they're not doing what you're asking them to do, well, then what do you expect? What do you think?
It's not for everyone, but that is my approach. I'm trying to get someone better, and honesty is a good policy.
All right, so fill me in. What else you want to get after in this? What am I missing that you want to dive into?
Oh man. Well, my practice. You mentioned that I just opened my own two-person, two-physician practice. So that's been something that I wanted to do for a really long time, but you wake up and you go to work the next day, and life is busy, and it's a big undertaking to start your own practice. And, with a family to manage.
5 kids.
Yeah. It's a lot going on, but they're a little older and everybody can mostly dress themselves. So I had a little bit more time on my hands. And then the pandemic happened and I had a lot of time on my hands.
What's that been like, opening up in the middle of a pandemic?
Well, there's a lot of uncertainty, what that's going to look like. I feel that the reason I decided to do that at this time was that, people have things that hurt, whether there's a pandemic or not. And I'm a physician who can help people. And I wasn't in a position where I was able to do that in my prior practice. And so I just decided to do it on my own. So I opened my own practice.
What is most different about your day-to-day now? And I'm sure we could talk about this in of itself. What is so different about what you do now compared to what you did before, right? Like whether it's either practice techniques or a day-to-day.
Yeah, there's a lot of differences. Obviously, as a new practice, the amount of people I'm seeing is less in a day. So I've really enjoyed the amount of time that I get to spend with my patients. And get to know them as people. And you find out more helpful information when you do that about why something might be going on. So that's a big difference.
How's that change your perspective on things? Because I noticed that when I started this.
Yeah.
It's like, man, I get to spend like a whole hour with this person.
Yeah, it's great.
Like,
yeah.
So like, was that like, wow, is this what it's like? Or
I just felt happier, like to connect with people and to be able to, I would always answer everybody's questions and give them the time that they needed. And then that would obviously translate into me running behind, which was stressful and created issues for those patients who are later in the day. And which, I respect people's time and I really disliked being behind, but you sort of are expected to see a certain amount of patients, and so it's just been nice to run on time and talk to people and make them feel better.
To sit in a room, especially in your case, you're sitting in a room where I'm on the floor, and I want to strategically put myself in a position as I'm working on the patient to glance at the clock, like that, like stress. Like that's sad. Like it's I
never looked at the clock in a room.
Never.
Not once.
Good for you. Like I would there's times I would
even know where it was.
Like let's stretch this way. I just want to take a quick glance without like being disrespectful. Like super self-aware. Just trying to like, all right, I'm not behind or I am behind or how far behind am I?
I would know going into the room kind of where I was in my schedule and how to manage that because obviously being cognizant of people's time is important. So while I wanted to answer everybody's questions and I don't think it ever affected my history taking and, performance of treatment. But
I agree with that completely.
But I never had time to, make small talk and sometimes that's important too, especially my older patients. I think they come out not just for their, knee injection or what have you, but it's a social excursion, and it's just nice to spend some time with them.
So how many people in a day are you looking forward to seeing in the future, like in a treatment, like your treatment model, right? Compared to what you saw before?
Let's see. Probably a little more than half of what I saw before, I would say.
Half.
Yeah.
That's awesome.
Yeah.
That's cool, because I know before it was probably a pretty high number. And I think...
And I managed that too,
Sure.
There's plenty of physicians that saw a lot more patients than me. I don't aim to see that many patients.
I think the patients appreciate that. I mean, that's probably, listen, there are plenty of complaints about physical therapy. I'll raise my hand first and say I can come up with plenty on my own about, all the things that are wrong with PT, et cetera, and at least in the Philadelphia area. But that's the biggest complaint I had, or even compliment I would get from patients talking about physicians, was they spent no time with me. Or why am I going to follow up again? I'm just going to sit with the PA for 5 minutes.
Yeah.
Not even 2 minutes. Or they were literally in and out. I didn't even, they didn't even put their hands on me, or they didn't watch me move. They were looking at a screen the whole time.
Right.
It's like, what do I say to reassure them?
I've had patients that have come to me and said, the last doctor didn't even touch me, which I kind of I can't even wrap my head around that. I mean, an exam is, obviously a very important part of the history and physical for when you're seeing a patient.
You're not gonna palpate the patient. You're not gonna you're not gonna do a strength assessment, or I don't know.
I mean, granted, you get so much from a history, and most of the time I know exactly what the problem is before. But there's been exams where I've been surprised, and like you said, there's weakness which changes what I might order or how I might work that up or treat it, or laxity in a joint, or a finding on exam that was like, oh, I actually wasn't expecting that, and now I changed the way I might work this up.
Well said.
Yeah.
So kind of got the present, got a little bit of your past. So you've opened up this practice. You're now a month to a month and a half.
Yes, 4 weeks.
Okay, and where are you located? You also have a place in Cherry Hill.
Yep.
Tell me about that location.
Yes, in Cherry Hill. We are there's a Velocity Sports Performance Center, physical therapy place within there, and then a podiatrist is in there, and we're all sort of in the same space, and we're there currently 1 day a week. My partner, Dr. Harris, will be seeing patients another day a week once he's licensed in New Jersey, which thank you, pandemic has been taking a while. So he'll be there 1 day a week, and then we're here obviously in your place in Newtown Square.
Awesome.
The other days of the week.
So fill me in on what direction do you see this going? What is your what's your plan?
I mean, obviously right now my sort of short-term future goals are to, be busy enough, to where we are taking good care of people and able to sustain our practice. And eventually I'd love to hire more like-minded physicians and have a larger group where, we're taking care of people like people, and, roll in some other aspects of care, a more comprehensive approach, and offering some of those things in-house, be it physical therapy or, that sort of transition between, well, you've rehabbed your injury and, now it's sort of getting back to your sport, and, and then maintaining that type of base training that you need to continue in the sport that injured you, so that you don't just kind of fall back into those patterns and have the same injury all over again. So
I love it. I'm sure we've spoken about this. That's my dream.
Yeah.
Is to have all like-minded, like-modeled.
Right.
To me, the model is everything. If you're going to see a million patients a day, then you're not going to help enough people the way you should. if we're all under the same roof and we're all speaking the same language,
Yep.
it's all about trust, right? I mean, like, trust is everything. That's why, we're doing kind of what we're doing.
Yep.
So, because I trust the heck out of you and vice versa. So I think if you can, like, that's like the perfect model where you can get all these people that you trust under the same roof that you would trust with the care of your patients.
Yep.
So if you can offer each of the different realms of what they need, but have the continuum of communication and care there, why isn't that out there? Like, and maybe it is. I'm sure it is. It definitely is out there. But
Yeah, it's. I think there are plenty of people who have similar concepts, and there are centers out there where people are trying to create that. I think that to some extent insurance companies sabotage that in where patients are allowed to go, and putting it all together. There's rules and laws about who can work with who, and but I think that finding a way through that and being able to have all the right people under one roof, or at least in a collaborative way, ends up with better outcomes for the patient. And I think they feel like they're cared for in a better way as well.
I had a young man come in today. I didn't get a chance to tell you this. A young man come in today to see Jordan, actually. And Jordan gave me a heads up in advance. He said, a former patient of yours is coming in to see me for a sports performance, but he didn't see you here. He saw you where you were at before. And I remembered him right away because I had him sign. This is something I started, and I want to get back into. I had him sign like a baseball. He was like 11 years old. It was like an elbow type thing going on, and had him sign baseball. And it's actually sitting on my nightstand at home. And I looked at it this morning. I'm like, I hope he's doing all right. Jordan tells me today he's coming in.
That's so crazy.
And so after they had their conversation, I went over. I'm like, hey, man, how you doing? How you been? So his dad. And I'm like, you're never going to guess who else is here, too. He's like, who? And I said, Dr. Beatty's here. And he's like, get out. You got to be kidding me, because I got to you guys through someone recommending Jordan, and then also found out that you were here.
That's
so I was
so
like,
funny.
definitely trust that place. And now I find out that Dr. B's here. Like, I'm sold.
All the people are here.
The whole gang's here.
We're starting.
All right. This
great.
has been everything I expected and more. So please share with our listeners how to get in touch with you.
There are a few ways. You can call our office, 610-601-9177. You can go to our website, Beatty Harris Sports Med. I could spell that if you'd like, but
we'll post it. It'll be written down in the notes, so check the notes.
And so you can request an appointment on our website. You can check out what we treat, what we do, who we are, what we're about, and that's how you can get in touch with me.
Awesome.
We drive by, pop in.
Yeah, we're located on Westchester Pike. So this has been cool. All right. Any Instagram? You guys have an Instagram too, right?
We do. We have a Facebook and Instagram, Beatty Harris Sports Medicine and Beatty Harris Sports Med.
Awesome.
Yeah.
All right. I think we should do like a part 2 at some point.
That'd be great.
All right.
So much more to talk about.
All right. Awesome time.
Thanks so much for having me.
Thanks for listening to the On-Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.